Hi, I'm Dr. Brian Thornburg, and I want to review functional medicine. I have not discussed this for a while, and I want to bring it back up because it's such a great and refreshing way to look at the body. In traditional medicine, I'm board certified by the allopaths or the MDs. We look at a disease-based model, and a disease-based model is one that looks at organ systems. We have a skin doctor, heart doctor, kidney doctor, and inside of these separate organ systems, we're specially trained, and then we focus on some disease prevention, but mostly it's disease management by reducing symptoms to create a sense of lack of symptoms and not so much moving beyond that point into wellness. Functional medicine can certainly bring you to the point of lack of symptoms, just like allopathic medicine, but it is designed to move you beyond that point into a sense of wellness. So what's the significance of functional medicine? Why is it so different? So functional medicine works upstream from what the allopaths or MDs are doing. What that means is there are 7 functional systems that underlie all organ systems or the different specialties in MD medicine. And these 7 functional systems then can be addressed upstream because now we have the science to look at these. Back when medical education was created in the 1920s and 1930s and 40s, it was based on microscopes and gross anatomy. We didn't have an understanding of DNA. We didn't understand about enzymes. We didn't have electron microscopes. So there was a lot lacking of what we know now back then. But unfortunately, medical education has not changed its stripes. It's still very much disease-based, based on organ systems, even though science has moved well beyond what is capable and how we understand the body. So returning back to the functional systems, there are 7 systems. They underlie all the organ systems, and they're upstream, which means if we can make a correction upstream, that means we can clean the water going downstream, so to speak, and then that will make a healthier environment down in the organ systems and create that lack of symptoms and move us into wellness. So the 7 functional systems are assimilation. This is how do we digest our foods? How do we absorb our foods? And what is the microbiome or the bacteria like that live in our gut? Then we have defense and repair. 80% of our immune system sits around our gut. And so if we're eating inflammatory foods, there are bacteria, parasites, worms, anything that's living in our gut that shouldn't be there or in the wrong amounts. That's going to create inflammation. It's going to create an unhealthy gut environment. Since 80% of the immune system sits there, that's going to release inflammatory markers that are going to move throughout the body. So inflammation that happens in the gut is going to be dispersed everywhere, and that's going to have an effect everywhere throughout the body, all the different organ systems. Then we have biotransformation and elimination. This is how well does our liver work? How well does our kidneys work? How well can our gut, which is how we excrete most of the toxins, how well can all of these different processes work? We have communication. What is the cardiovascular health? What's the lymphatic health? How well are these things working? We have structural integrity. What is happening with the muscles, tendons? What is the cellular membrane like? Because the cellular membrane is what helps create definitions inside of our body and allow functions to happen where they're supposed to happen without leakage or decreased functionality. We have energy. Energy is how well does our mitochondria work? Also, how well can we extract energy from the food to then be converted into ATP, which is the currency for our energy work. Communication is the neurotransmitters, it's the hormones, and are these working in normal and appropriate amounts? So when we look at the 7 functional systems, we can then use scientific data from going to labs, not mainstream labs. We have to go to very specific functional medicine, and we can draw these tests that then help identify these upstream issues that may be affecting and most certainly are likely affecting the organ functions downstream. I'm doing a case study on a 15-year-old girl with POTS. POTS is postural orthostatic tachycardic syndrome. This happens to people for some unknown cause. It is an overactivation of their autonomic system. It results in heart rate increases, and that can then make them feel dizzy, lightheaded, nauseous, brain fog, inability to exercise. And so I have a 15-year-old girl that's experiencing this now, and we're going to start journeying down this functional medicine path. So stay tuned. Thanks.